Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of Geriatrician Dr. Andy Mencia. Okay.
Well, good morning.
Good morning. Well, we have a bright and shining sun here right in our studio.
Wow, it's so beautiful. What a beautiful golden sunrise.
Yes, and you brought a beautiful, gorgeous sunriser.
Yes. Miss SILVIA Otero.
Okay,
Thank you so much. Good morning. To
Besides
all of
looking
Good
so
morning,
good, what
Sylvia.
does Sylvia
Good morning.
Otero do?
Well, she's esthetician, so she does facial, and we always talk about taking care of your body, the wonderful well awareness, and we talk about the importance of taking care of your body from the inside out. Sometimes we tend to forget the out until it is too late. And I get a lot of my patients, the young baby boomers that come in and say, Dr. Mencia, I'm getting this little wrinkle here and there. What can you do for me? And that's good preventive. It's not preventive for health, but preventive for maintenance of your beauty and your youthfulness.
Okay, so I have to ask you a question.
Mm-hmm.
Get ready.
Not about sex.
No.
Okay.
Well, it leads to sex, I guess.
Okay.
Sorry. How do you keep your face so absolutely beautifully flawless? And it is. You have an incredible skin. That's before you met.
That's before
Sylvia.
I met Sylvia. Way before I met Sylvia. I learned from my father. A very smart person he was. And I learned that stress is one of your worst enemy. So, when you want to avoid aging, avoid stress. And stress will, like he used to say to me, stress is part of life, but it's like driving a car. You're going to see the light pole, just let them go by. Don't hit them, just let those light poles go by. And stress in your life, when they come, see like those light poles, just let those light or those objects go by you as you are driving through the highway of aging.
The highway of aging. Oh my gosh, I love that.
So that's one of the main things. We tend to get stressed out, and some of us, even worse, we tend to magnify little things because we stop in front of one of those light poles, and we want to know, like, what can we do with this light pole? Why is this on my way? It's not, the light pole is not even on your way. You are on the way of the light. So it's we tend to take a little problem and we focus on this and we magnify them, and you stop your life. You stop living to try to solve something that will be solved. Sometimes it gets resolved by itself. You just have to let go and move on. And do it in a responsible way. Something that is important, you are not going to overlook that, but you want to take care of that. So it's all start with the mind with regard to aging. So one of the things that I do in my personal case, I do my meditation. I eat healthy because the skin is the largest organ that we have in our body. It's not the liver, it's not the lung. The intestine, if you extend the intestine from end to end, from mouth to anus, you extend it out, it's a football field long. That's very long. But the skin is still the largest organ that we have when it comes to surface area. And understanding that your skin is an organ, it depends on your psyche, therefore the stress. It depends on your spirit. It depends on your nutrition. It depends on hydration. So everything that you do for your body, in reality, you are also doing it for your skin. So a person that go and get a sunburn and at the same time do not hydrate him or herself, you are speeding up the process of aging. Well, if you always hydrate yourself, follow good nutrition, supplement when necessary. And a lot of time, if you follow a good diet, you are getting a lot of supplements right from there. So doing all of those things from the inside, you are taking good care of your skin. Now, as before we went on the air, Sylvia was saying there are many products out there for the skin. It's a multi-billion-dollar company, a business, skin products. There's a lot of junk out there. And there are junk out there that costs a lot of money because some people say if it's expensive, it must be good. Some people, they know that there's a group of consumers that will go for the expensive stuff. And for those like me that believe in homeopathic treatment, there's a lot of things you can do at home. Mm-hmm. With avocado, and with papaya, honey mint, oatmeal. There's so many things that you have at home that can take good care of your skin. The detergent that you use, some people think the stronger the detergent, the better for you. You take your detergent for washing your clothes and wash your face, you're going to damage your skin. So you want to use a detergent that is mild. The skin is fragile, and you want to use a detergent that is mild. And that's for a normal skin. Then you take and say, okay, what about me? One of those listeners out there that say, I bruise easily. Or I have what they call fragile skin, which means the skin layers have decreased so much that your skin can break very easily. So that's where somebody like Sylvia will come in and say, well, a very strong peel on your face is not good for you because your skin is too thin. We have to work on building up collagen and all of that. So,
well, that's a good point, though. But I'm looking at your skin, and no, seriously, and it is so beautiful. No, it's so beautiful. And of course, I'm looking at Sylvia's skin, and it is so beautiful. And I guess I do have one question about it.
And I look at your skin; it's so beautiful.
Thank you. So my question is, do you bring natural from your genes? In other words, your family, I would dare say maybe your father and mother had your skin and maybe the same for you. Or can you really take people who have very bad skin and make them look like both of you? Or
yes.
Can you really?
Yes, you can. You have to work in the overall picture. The overall picture of the skin. It's your collagen that have decreased, so we can increase your collagen content. It's not only working on the outside, and that's the beauty between Sylvia and I working together, because she will consult me as a medical doctor. Dr. Mencia, what would you suggest? Not only that, she has a dietitian that works right next with Sylvia and I. So you have the dietitian, you have a medical doctor, and you have the esthetician working all together and communicating and consulting with each other. And that what makes Sylvia different from a esthetician out there in the street by themselves.
I agree. Well, I wanted to talk to you a little bit, Sylvia, about this. There is something, and I don't know, as a person who, you're the one that does the facials, whether you receive the facials, but for me, there is nothing more relaxing, anything, than having a facial. I mean, and I don't understand why. What are you doing to to me to make me go into dreamland?
Well, first of all, thank you very much for inviting me, Dr. Mencia, and for you guys. Good morning to all of you. He has a good point. The way we eating is very important for our skin. The way we resolve our situations daily, even if we have big issues, everything reflects in our skin. Also, when you go and get a treatment, the first thing that I will ask you is relax. Breathe and relax. It's going to be an hour or an hour and a half of a treatment where you're going to feel like a new skin, to teach you how to relax and breathe. Even though you have our skin, we have to make it softer and glowy. So is one of the things that eating is very important, and also relax your body and trying to get everything. I mean, your skin will breathe. You appreciate that time, because worries and everything is gonna show to.
And the ambient that you set up, I noticed that you have that ambient with the music, you dim the
tranquility.
light. Yes.
And the waterfall.
The water, everything.
But something Dr. Mencia was saying, though, the certain products. So where you could have a facial with just very expensive products, or you could have a facial with natural. So we may eat an avocado, but you would like to put an avocado cream on her face. Sounds
true. Like a lot of patients that I've seen, they're very concerned about their dryness. And sometimes I say, look, don't worry. Sometimes you have things in your house that, you don't have to buy expensive cream. Maybe with a little bit of honey and lime, and a squeeze of lime, you put it in your face, even if you don't have the money to do it. Make your face really soft. Even if you have a brown spot, will take away. What the main thing we're gonna trying to do in here is to trying to get your skin as natural and organic, as possible, and helping you to get in supplements for your skin, like collagen, like vitamins, like arnica, like so many supplements that we need to help our skin to get better and to get healthier. So
I love that. And, we always wind up doing something sexy on the show. I don't know why. When Dr. Mencia walks in, that's
just
Mr.
swimming
Sex
in the honey.
I was just thinking about that. Bill, come lick my face. It's full of honey and lime. But, honey, I don't like lime. Well, that's all right. Well, we won't.
Yeah.
No, but I do hear what you're saying. So you're saying that people have in their own home things that they don't have to maybe sometimes they have to use other things. I don't
know other things, obviously.
Right. Yeah. They need to know what to do. And will you tell people when they come to you? Will you tell them some of those kinds of things? Because I think you ought to do maybe a sheet on it. It sounds really interesting.
Mm-hmm. The main thing is just to look at your skin and give you like
an assessment,
exactly.
on what the person needs.
Exactly. And after I recommend you the best for your skin, because not every single skin is the same. We have a very sensitive, another has a very thick skin, dry, very greasy skin. So not every single one is the same, and not all the products. Maybe you have a friend and you see the skin, oh my God, what do you do? What do you put in your skin? No, it's such a thing, any product. Maybe for her will work, but not for you.
Right.
Because it's a different, we have all different type of skin. And that's why I going to be there to help you to get the best of the best for you. It doesn't have to be expensive. It could be right there in your house. It could be, we can help you to get there, because we're going to have a lot of the products that you may need. We're going to have it in there too.
And the facial that you do, Sylvia, there are different type of facial. I know sometimes when I go for a facial, they say, oh, you need a little bit more hydration. We're going to do this. You need this. What are the different type of facial that you offer?
Well, like I say, I will be analyze your skin first, and I will recommend you exactly what we're going to do. And we have from freshness, cleansing your face, that's a deep, very exfoliation with a collagen mask, and that improves the tone and the texture of your skin. We have the anti-aging facial. That's a very nice one, and it's a very deep
very
one,
popular.
Very much. That's it's gonna help you collagen to increase more, and to for your skin to look more glowy and healthy. Even though we don't think that we have collagen, we do have collagen underneath our skin level. The layers. So with
you want to bring them up.
You want to sort of activate them.
We activate it with the special machines, the LED machines, very light doesn't, it will help you to get that glowy, that collagen go back to your skin.
I'm gonna take you back for 1 second. So were you a little girl and you liked to play with mud? What did you do to when well, we had mud. A lot of people put mud on their face.
Being honest with you, a lot of my research when is trying to get the most of the earth to bring it to our patients. We have a lot of products that are coming from the mud from Hawaii.
Right.
Yeah,
they're coming from Hawaii.
That's right.
And from your country, from Colombia.
My country, from Colombia.
Yeah, there's a lot of good product that get exported from Colombia, from Hawaii.
So what is it?
That's how I met
earth?
Sylvia, as a matter of fact. When I started my line of products, Mencia, me and Sylvia, we met, and I loved the fact that she was able to bring product together that was natural and easy to use, very universal that anybody can use. And I thought, okay, make something with collagen and let me try it out before I even go anywhere. I forget about my stuff. I said, I want to see what it is. And
she actually takes something and makes it?
She brought something from the lab. She brought
see.
something for the lab, and I started using it. It didn't irritate my skin. It didn't do anything bad to my skin. But the patient will say, oh, your skin looks so nice. And I say, okay, Sylvia, the product is really good. I'm going to put my name on it.
Oh.
And then we started selling it, and the staff started using it. And to this date, and we've been together for over 3 years. And to this date, I still use the product that she produces.
So if someone...
And then when she told me about, doing facial and all that, I said, oh, my God, that would be, having you with your knowledge, your chemical background and all of that. I said, this will be... perfect for me. That's what I'm looking for. I'm looking for the best of the best. So
and you have always been wanting to get into this field with with skincare and all because that's really exciting. I didn't know that you existed before this. I thought I knew everything about his life. See, he keeps secrets from me.
Yeah, she's my secret.
Yeah, he's a secret. But this is extraordinary that you're doing this for them because there are really people who are aging. They don't want to age. But some of them have never had a facial. And when you say that, it's like, a facial? Why? I can't have a facial. It's like it's this magic thing. Mm-hmm. So you're saying that now a facial is going to be like take my blood pressure, do this, and all of a sudden have a facial. It's all part of this whole comprehensive.
Yeah, to have a facial, if you look at the skin and you start magnifying, you just take a magnifying glass. And look at your skin and, bring the glass down so you see. You're going to see the hair. And then you can see this little hole. They are called pores. Mm-hmm. So guess what? When dirt and dust and all of these things from the environment come around, they settle down on those pores. And, you will notice a lot of people get skin cancer. They get it on their face, on their décolleté area. Mm-hmm. When you are driving a car, when the air conditioner is hitting you, it's hitting you here. It's not hitting your back, your thigh, your butt. It's hitting you here. So we tend to find most of the cancer on this exposed area. And we tend to blame the sun. The sun is a good thing. We need the sun for the vitamin D activation. The sun is not our enemy. It's a good thing out there. If we misuse the sun, it can be harmful. But those pores need to be treated. So imagine a person that says, I'm not going to shower. I'm going to go and be a doctor and work, but I won't shower anymore. People will walk away from you. You're going to get to a point you're going to smell so bad. like we see homeless people out there that do not shower. So the skin, even though you take a shower and you use soap and what have you, you are not going really deep into those pores. Superficially you look clean, you smell clean, but you're not all the way clean. It takes time. If you notice people that do, take care of the skin, they sit in front of the mirror, they sit by some place in the house, and to do take care of the skin, to not only putting on makeup, just taking care of the skin. And, I go through my ritual every morning and in the evening, taking care of my skin. It's part of my ritual. I put my clothes out, I get things, what I'm going to wear, and I make sure I take care of my skin. But even when I go for a facial, and I get a facial, despite what I do for my skin, she will pull out stuff that I didn't know was there, a lot of dirt and stuff that still accumulate inside those pores. So, to open the pores up is important. Then after you open the pores, you want to bring them close back together, because some people use the wrong chemicals and they clean your pores and they are exposed, and it's like having a baby and putting it on the middle of the street to see which way the baby is going to go. So once you clean those pores, now you have to nourish the skin. You have to do something to nourish the skin. So
I think to nourish you, I have to give everybody information, because they're wanting to know.
They're going to be calling for Sylvia now. The doctor, give me Sylvia.
Who is it? Where do we have to go? We have to go to Columbia? I don't think so. No. We're going to go right here. So we're going to go to AGI Medical and Dental Centers, founded by Dr. Andy Mencia. And the phone number to call if you want an appointment to have a facial, to meet Sylvia, that'll be a treat for you. It's 954-489-1345. Again, that's 954-489-1345. And if you want to go to Boynton Beach for a medical dental work, that's 561-270-6494. Don't forget, their home visit services are available for homebound patients. Very important. Also go on the website to agifl.com. Okay, so Sylvia, in the time we have left, I was thinking what would be a wonderful thing, since you seem to know a lot of natural ways, like you talked about the honey and the lime. It might be fun to have an article that you could talk to people. Now, people just can't that's not the way they're going to keep their face done. It's a treat. But maybe you know of a lot of other things that people could just take out of their magic box, like coconut oil, things that maybe they could do for their hair, for their face.
That's true.
And that could be a wonderful article. Then you could hand it out.
I will be more than happy to come back and share with you.
I think that would be great.
And with our readers, because we have this article.
Yeah, that's what we'll do. And then people will love that.
I'll do that. There is a lot of tricks up there that will help you. And like you say, it's not only the facial that we're going to do. I will help you to analyze, to take care of your skin. From now on, since when you meet me, you're going to see that I will help you to get more of your shiny and your glowy, and get your healthy skin back home, and show you a lot of tricks and natural tricks that, it's not only facial. I'm going to make you feel like a queen or like a king.
A queen or king, but I want to talk about the king.
Look at Richard. He's calling in already. Set up my appointment.
What do you do with his mustache? What do you do with the mustache? I have to figure that out. But
we put honey. We put honey
in there.
But that's a very good point. Men should also be considering facials, and most of them would look at you like they're crazy.
Yes, absolutely.
It's not only we women. We need to look pretty. They, like the Dr. Mencia say, is the big organs that we have. We have to help. We have to. Our face is just the first thing to show. The impression of all the world. Is the image of us.
That first image that we see.
Exactly, the first image. So whatever we eat inside is gonna go outside. We have to take care of ourselves. No matter if you have a lot of problems or if you're happy, it's no matter that you have to show it in your skin. Our skin will talk. We'll talk.
Well, you can't see this on television, but because it's radio. But I'm going to feel her skin. Come closer. Oh, my finger slipped off her face. I'm going to feel your face. Whoa, this is feel FaceTime.
And you can tell,
Yeah, you can tell.
her skin
Very,
is
yeah,
so
very
glossy and
beautiful.
smooth,
Yeah.
beautiful
And so,
skin.
and now, of course, she's 16 years old. So what else
Yeah,
can you
I
expect?
know.
So at 16,
Yeah, 16 with a 19-year-old doctor. Imagine, I
you
don't
have
know.
a what daughter? You have a 19-year-old daughter?
20 years.
A 20-year-old daughter? Oh, no. The daughter, you're the daughter. Oh, you're kidding. Okay.
I can
you.
see both of them in the street and they treat them like sisters.
Listen, absolutely, let me tell you. Just go there to meet her. It's going to be worth even not having the facial.
Yeah.
That's Sylvia. And so, I don't want to attribute just to your face. I mean, to your facials, but you have really good genes. You have really good everything.
you.
Oh my gosh! Leave it to Dr. Mencia.
And
He finds the best everywhere.
Thank you.
Person that walk the talk.
Yeah, walks the talk.
Remember, it's never late to look good. Never, never. I'm going to
Good
be
point.
more than happy to help you. Just call us and let me know if you need my help, my expertise, and to bring you shiny, glowy, healthy skin back home.
Shiny,
is so-
glowy health. I love how she says that.
you know,
With a lovely accent. Shiny, glowy health. I have to
That
put
is
that
so
down.
important. I had a 89-year-old person that came in, 89 years old, and she said, Dr. Mencia, I want to do the Botox for my face because for my 90th birthday. And that was the gift to herself. So age is not, don't let age stop you from feeling and looking young.
Thank you very much, and we will be back next week. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.